Well, hello, it's Bruce Williams again, still doing my part and staying at home. And hopefully you're ready for Growth Path Challenge number 68. Let's begin. Slide number one is a fairly straightforward one. It's tissue from a puppy. Can you give me the name of this condition? Time's up on this one. This condition is known as ectopia cordis. It's seen in a wide variety of species. There are two locations that are primarily seen in this condition. This is the extrathoracic location, and you can also see it where the heart is up under the soft tissue of the neck. This is not a problem associated with defects in the heart. It's associated with delayed closure of the thoracic cavity, specifically the rib cage, and the heart is exteriorized. Remember that in development, the development of the skin generally follows the development of underlying bone. So there's usually a gap in the skin overlying the bony defect below, and this allows the heart to get through. Slide number two is tissue from a foal. Can you give me a morphologic diagnosis and a cause? You know it's a foal because it's pretty difficult to get the intestine and the colon of a mature horse on a light table. So this has got to be a very young foal. Okay, time's up. This is a congenital abnormality that is seen in white foals, often from pairings of Appaloosas or paints. The condition is called lethal white foal syndrome, and the morphologic diagnosis is segmental colonic aganglionosis. It is a defect in the receptor of the endothelin B gene. Now, innervation and the development of proper innervation, population of the myenteric plexus of the colon is generally the result of a combination of glial-derived neurotropic factor and endothelin B. Glial-derived neurotropic factor, which is not involved in this particular entity, is the gene that provides for the proliferation and development of the neurons which populate the myenteric plexus of primarily the colon. Endothelin B inhibits that proliferation and development, which allows these immature neurons to migrate through tissues and to find their spot in the myenteric plexus. When that's defective, they begin to proliferate and grow too quickly. They do not get to the spots that they are supposed to be in large enough numbers for proper development. And these animals develop segmental hypoplasia of parts of the colon, the small colon, and the rectum. This colon is very small, but it's actually patent. But remember, you have to have nervous innervation for development of the muscle, so the muscle is not developed properly. It's not a form of atresia like atresia coli, which would be usually just a strip of tissue without lumen. There's actually lumen here, but this part of the colon is not functional. These animals, unfortunately, die within the first several days to weeks of life with a flaming colitis. It is a corollary to a disease in people, which is similar, called Hirschsprung's disease. So this is lethal white foal. These animals aren't albino, but they are primarily white foals, not something that you want to see in your Appaloosa crosses. Slide number three is tissue from a chicken. Can you give me a morphologic diagnosis and the cause? Okay, time's up. For me, there are two types of skin disease in the chicken. You have those that affect the follicles, as we see here, and those that affect the interfollicular dermis. The interfollicular dermis looks pretty good, but every single follicle that I can see on this bird is enlarged. It's bulging. And this is one of the many manifestations of Marek's disease. The morphologic diagnosis is follicular lymphoma. I make it simple and just call follicular lymphoma. Some people say that it is a diffuse lymphoblastic perifolliculitis. And I guess that's okay, but I just try and make everything simple. It's lymphoma, and so follicular lymphoma works for me. The cause is avian herpes virus type 2, the Marek's disease virus. Slide number 4 is a classic. Hopefully you're looking at this and you can identify the species right off because of the light color and the shape of the kidneys. But if you can, I still have to give it to you in all fairness. And this is tissue from a pig. Can you give me a morphologic diagnosis and 2 possible causes? Okay, time's up. This is a classic lesion that's been described many times over the years in many editions in textbook. I think we're finally starting to get away from it. And this is known as a turkey egg kidney because turkey eggs are lightly brown and speckled. And the first person who looked at this said, oh, it looks like a turkey egg. Well, I wasn't the first person because I don't know if I've ever seen a turkey egg in person. But so this is a turkey egg kidney, but what we're actually looking at is multifocal to coalescing renal vasculitis. It's probably glomerular. A lot of these are going to represent vasculitis, which affects the glomeruli, but there are probably some other vessels affected in this kidney as well. So multifocal coalescing or diffuse renal vasculitis would be fine here. And there are a couple of conditions that I would think about. First and foremost, which cause vasculitis. One is going to be a disease that is known as classical swine fever. I learned it as hog cholera, and it is the result of infection by porcine pestivirus, and it causes a vasculitis throughout the body, which manifests very nicely in the kidney. There are a couple of bacteria that will cause this lesion. There are probably many bacteria that might cause this lesion that you might want to think about. One of them is going to be Salmonella cholera suis, the host-adapted salmonellas in pigs, Salmonella cholera suis and Salmonella typhi suis. Instead of causing the classic severe necrotizing enteritis that we think of, when they're host-adapted, they tend to cause septicemia. And so you see hemorrhages, vasculitis, and infarction in a number of organs. Another classic bacteria that will cause vascular lesions is going to be Erysipelathrix bruciopathi. And it's very recognizable in the skin as the cause of diamondback disease, but that is a bacterium that causes thrombosis in tissues all over the body, and the kidneys would be expected to look like this. I think one more that you probably should consider, you may have larger areas of hemorrhage and vasculitis over time, especially glomerular damage, is going to be porcine circovirus type 2, the classic porcine dermatitis and nephritis syndrome. Will also give you hemorrhages. I'm sure there's a bunch of others that you could probably think of that will give you this lesion. The turkey egg kidney is certainly not a specific lesion with a number of viruses and bacteria causing it, but I think the 4 that we mentioned should be on everyone's list for hemorrhages in the kidney of a pig. Can we go on to slide number 5? This is tissue from an ox. How about a morphologic diagnosis and a cause? Okay, time's up. Well, we're looking at the mandibular incisors of this ox. They are discolored. The enamel has been broken away in a number of spots, and we're looking at the underlying darker dentin. This is a classic disease that is associated with exposure to fluoride and the animals that are grazing in areas where there has been contamination of the groundwater or even the topsoil with fluoride. So this would be outside of smelting plants or aluminum plants. And the problem with fluoride is that the body, when it absorbs fluoride, it doesn't see any difference between fluoride and calcium. And it will go ahead, it will incorporate it into the places that it normally will incorporate calcium. In the bone, it will incorporate it into the hydroxyapatite lattice. So everywhere there's supposed to be calcium, there's fluoride. The bones that are formed become very white and chalky and brittle. It's not like normal bone. And the body, recognizing that this bone is weak, will put down a lot of extra periosteal bone, which is also going to be white and chalky. So if you ever see a section of bone from these animals that has had the tissue stripped off of it, it's very proliferative and it just looks white and abnormal. Remember that calcium is also used by the odontoblasts and the ameloblasts as well. And what happens is you get weakened enamel and dentin, and the enamel will just crack off as part of normal chewing. The morphologic diagnosis would be enamel and dentinal dysplasia and fracture. And when you look at this, there's a nice picture was written, a nice article that was written probably about 30 years ago with scanning EM, and you can see that the tubules are just sheared off. It's not that they weren't formed, they were formed, they were abnormal, and the normal process of chewing just sort of breaks them off. So this is a great case of fluorosis in ruminants. Slide number 6 is tissue from a dog. Can you give me a morphologic diagnosis and a cause? Okay, time's up. We are looking at a fixed testis, and this is probably an older slide because we don't see this much anymore. The problem is not in the testis proper, but in the epididymis. Okay, remember that the testicle is composed of two separate organs, the testis and the epididymis. I'm old-fashioned, I call the whole thing testis, but that's actually wrong. But this is a disease that primarily affects the epididymis. You can see the epididymis is much larger than the testis. There are areas of hemorrhage and necrosis, and this is an epididymitis. One of the classic epididymitis of dogs is Brucella canis. Brucella canis is generally transmitted venereally. It does cause a septicemia. You can have thrombosis, number of organs, but it tends to concentrate in the epididymis. And there'll be a combination of coagulative necrosis due to vascular thrombosis. There's also lymphocytic inflammation. And then you will have rupture of some of these tubules, release of the sperm, and a granulomatous inflammation. So it's a mixed granulomatous and lymphocytic inflammation with vasculitis in the epididymis. If you gave me a morphologic diagnosis of granulomatous and lymphocytic epididymitis, I'm very happy with that. I would add the with testicular atrophy. The pressure, the inflammation, the heat of the inflamed epididymis is enough for degeneration of the seminiferous tubules of the testis to occur. The animal will undergo eventually aspermia. These animals often will have a concurrent prostatitis, and the prostate is one of the places where the bacterium likes to collect and thrive and cause a latent infection. These animals often will have scrotal ulceration because of the pain of this condition and the constant licking and chewing, and some of them may go to the point they actually try to castrate themselves before they can get taken to the vet. I think that nowadays you have a lot more gram negatives that will cause this particular condition. If you gave me a classic gram negative like E. coli, I would be forced to accept it, but I think it's important, especially in parts of the world where brucella is still a common problem, to know about Brucella canis and epididymitis in male dogs. Okay, slide number 7 is tissue from a sheep. Can you give me a morphologic diagnosis and a cause? Okay, time's up. We are looking at the intestine of a sheep, and there are all of these nodules on the outside of the intestine. This condition that is sometimes called pimply gut in sheep, and it can be a very problematic condition. The morphologic diagnosis is multifocal to coalescing granulomatous uh, enteritis. I think that's fine. Um, and the cause are a number of nematode parasites. There are two which belong to the Esophagostomum genus, Esophagostomum columbianum and Esophagostomum venulosum. And there's another one called Schabertia. I can't remember the species name on that. Oh, yes, I can. Schabertia ovina. And they both have similar lesions that can be spread in the small intestine and the colon. And what we're seeing are granulomas of the muscularis and the serosa. What happens is when the eggs are ingested, the immature larvae come out of the eggs, and in their third and fourth stage, they migrate into the wall of the intestine. Not all of them, but some of them, forming these granulomas. Some go on to just go ahead and develop into adults in the small intestine and colon to continue the life cycle. What often happens in these granulomas is the larva will die over time. They will mineralize, and you'll get these hard, often reddish black nodules in the wall of the gut. Now, for lambs, a good infection of the adult worms can cause significant problems, weight loss, and even death. You can also see complications as a result of the formation of these granulomas. Sometimes the animals or the nematodes will migrate through and rupture. You can have adhesions. You can have, obviously, with a lot of these mineralized granulomas, you can have some problems with normal peristaltic movements and obstruction. So all of these are possibilities. We also see esophagostomiasis in the small intestine in in the large intestine of non-human primates. Esophagostomum, there are a number of species, including Apiostomum and radiatum. So we see those in non-human primates, and we see different species in small ruminants, and cattle also are affected, Esophagostomum venulosum being one of the more common ones in cattle. So pimply gut, not totally an innocent finding in small ruminants. Let's move on to, we're on to cattle. Can you give me a morphologic diagnosis for this condition? Okay, time's up. This is a neoplasms that can be seen in calves as well as adult animals. And when we see these pearlescent nodules that affect the omentum and the mesentery, may spread out over the intestine, it can also be seen in the thoracic cavity as well. Once you think about mesothelioma, mesothelioma can histologically take two different forms. It can look like big polygonal mesothelial cells we're all used to, or can also spindle out and look very sarcomatous, or some of them may show a combination of both, with the sarcomatous cells tending to form a deep layer and infiltrate the omentum or mesentery. So this pearlescent tumor, if we're looking at ruminants, I always want to go with mesothelioma. They do not tend to develop carcinomatosis to the extent that most other species do. If this was a dog or a cat, I might think of a carcinoma as well. And those histologically can be somewhat difficult to differentiate. And I've been tricked more than once into thinking that a carcinoma was actually mesothelioma, and vice versa. One other thing that looks like this, especially if you are looking at animals up in the north central part of the country, in Michigan, Wisconsin, Minnesota, and you are looking at wild ruminants like white-tailed deer, you see these pearlescent nodules. I want you to be very careful and think about Mycobacterium bovis. Mycobacterium bovis looks very similar to this in wild ruminants. It's become a real problem up there. I know that most veterinary diagnostic labs, when the white-tailed deer come in, they go into a enhanced form of PPE. The animals are generally dissected under BSL-3 conditions. But that's regional, and but it does have a very similar appearance. So if I was to tell you this is white-tailed deer, again, we go with a granulomatous peritonitis due to Mycobacterium bovis. Slide number 9, tissue from 3 ducks. How about name the condition and name the disease? Okay, time's up. These are 3 male ducks. We see that the penis in each one is prolapsed. That's not the normal state of these animals, but it does is a well-documented sign in male ducks which are infected with annatid herpes virus type 1. The name of the disease is duck viral enteritis, or some people call it duck plague. I think duck viral enteritis is a better answer. The name of the condition is paraphimosis, and it doesn't happen in all male ducks, but it has been documented as a postmortem lesion in this particular condition. So that's about all I can tell you about this one. We've looked at other tissues of these animals in addition to necrotic enteritis. They often manifest with a pretty profound necrosis of the annular pyrus patches in various parts of the GI tract. But paraphimosis, I'll associate that with duck viral enteritis. Okay, slide number 10 is tissue from a cat. Can you give me a morphologic diagnosis? Okay, you got to look at the whole slide on this one. We have a very well demarcated neoplasm, which appears to be arising from a meninges. When you look at brain tumors in cats, you open up the brain, 80 to 90% are going to be meningiomas. You get a lot of meningiomas. They tend not to be invasive. Dogs, they tend to be a little more invasive. As they get bigger, they may invade the underlying parenchyma. In cats, they're usually pretty good. If you catch them early, you can excise them. Remember that they generally arise in the meninges, and then they grow outward. But there's not a lot of room to grow outward. They're growing outward, and then they hit the skull, but they're not going to stop growing. So as they grow, they tend to compress the underlying tissue. In this particular case, it was growing in the posterior compartment over the cerebellum. So we have a very nice area of pressure necrosis and atrophy of the cerebellum, which fits this tumor perfectly. The full morphologic diagnosis would be meningioma with cerebellar pressure necrosis and atrophy. Always make sure that you get that pressure atrophy into your morphologic diagnosis. It's tough to tell. Other things that you may want to look for are herniation of the cerebellar vermis through the foramen magnum. Anytime you have anything that's pushing on the brain, swelling and taking up room. There's not a lot of room in the skull, so it's going to cause herniation in a number of spots. Also a little bit of meningeal fibrosis here. It's probably an older cat, not worth a morphologic diagnosis. Well, that brings us to the end of this Growth Path Challenge. I hope that you have enjoyed it. I hope that you'll come back again to wherever you're viewing these on, whether it's Facebook or it's the Foundation's YouTube channel or it's the JPC's video library. There's a complete listing of these in the JPC's video library. And while you're at Ask JPC, you can take some time and browse through the Wednesday slide conference results. Those results go all the way back through the 1970, and if you go back all the way through 2007, there are virtual slides, capture static images, and it's a wonderful resource. And then, of course, the Veterinary Systemic Pathology Online, where you can get more information on almost all of these conditions we've talked about today. There's a wonderful search function there, and it's also on Google as well. Any of these various diseases we've talked about today, from esophagostomitis to brucellosis to duct viral enteritis. Another easy way to get great information is just to type in the name of the disease into Google search with JPC as a search word, and it will take you to the Wednesday slide conference or the VISPO entries for those entities. Well, with that, thanks so much for spending some time with me today. I'll be back tomorrow with another Growth Path Challenge. Looks like we're going to be here for a while, so let's all enjoy the time as best we can. Take care now.